Another important function of vitamin A is the maintenance of epithelium. Maintenance of epithelium. So vitamin A is required for the formation of glycolipid, and that glycolipid, if you recall your memory on your subject in 309, I told you that the glycolipids are basically the compound lipid. So vitamin A is involved and it is required in the formation of glycolipid, and that glycolipid is termed as retinol phosphate mannose glycolipid. Retinol phosphate mannose glycolipid, which is present in variety of cell membrane. So in the absence of vitamin A, the mucous lining will be affected, and if the glycolipid is absent, that will affect the goblet cell, that will affect in the proliferation of cell. Okay, so mucus secretions will be minimized. In the absence of vitamin A, a normal epithelium, what will happen with the epithelium? The normal epithelium will be replaced by a stratified, dry and keratinized epithelium. A stratified and keratinized epithelium. Now this epithelium is susceptible to infections. So keratinization can affect eye, respiratory tract, genital or urinary tract, as well as your skin. So that is the reason of acne vulgaris too. Deficiency of vitamin A leads to growth retardation, specifically in the growing age, and it may also lead to cause defective bone development. It can also defect on the teeth development, because abnormality can arise in terms of defective formation of tooth enamel. In case of eye, the deficiency of vitamin A can cause xerophthalmia. Xerophthalmia, what is xerophthalmia? क्या होगा? Not night blindness. Xerophthalmia, that is dryness of the eye. Okay, so small white patches appear on the outer and inner side of cornea covered by material. These patches can also be known as bitot spot, B-I-T-O-T, bitot spot, and they are the early symptom of vitamin A deficiency. They are the early symptom of vitamin A deficiency. A grayish-white foamy triangular spots were arising in the conjunctiva, and it is due to increased thickness of conjunctiva at some area. Keratin mixed with the gas forming bacteria which are known as cyanobacterium xerosis, and that will lead to cause or appear in the form of foamy appearance in the eye. Now come to keratomalacia, which is also the deficiency sign of or deficiency appearing due to the deficiency of vitamin A. It occurs first year of the life. In this, cornea will become dull and insensitive. The infiltrate increases and cause necrosis, the breakdown of cell lining. Necrosis means breakdown of cell lining, and due to this, vision can be lost because cornea will start melting. The dark area of your eye will be converted or will be breakdown or will be necrosed with the foamy type or greyish type of material, and that is the leading cause of blindness. Now come to night blindness. Night blindness can also be termed as, these are the deficiency signs. Okay, we have already talked about that how it is playing role in dark and how it is helping us to visualize in the darkness. And night blindness can also be termed as nyctalopia, Nyctalopia. Nyctalopia which is a condition characterized by inability to see in the dim light or at the night. It can be defined, or it is a condition which is characterized by an abnormal or inability to see in the dim light or night, typically caused by vitamin A deficiency. The most common cause of nyctalopia is retinitis pigmentosa. Retinitis pigmentosa, it is a disorder in which rod cells in the retina gradually lost their ability to respond to light. The patient suffering from genetic problem in the retina is gradually losing, and their ability is lost, and this condition has or have progressive towards nyctalopia, and eventually their daytime vision can also be affected. Infertility and trouble in conceiving can also be observed in the vitamin A deficiency. It is the research which is done, and it is observed that there may be one of the cause of infertility or inability in conceiving is the deficiency of vitamin A. Acne vulgaris, मैंने आपको पहले ही बता दिया कि acne vulgaris can also occur and arise. It is a major cause of vitamin A deficiency because the skin is hyperkeratinized, and after that it is susceptible and prone to infectious disorder. So infection may lead to cause damage your skin surface too. Now come to hypervitaminosis. As the deficiency is affecting your body in terms of different type of illnesses, similarly if we are taking excessive amount of any of the vitamin, it may lead to cause certain problem. In case of vitamin A, if it is given excessively, the condition may be acute and chronic, and it may be teratogenic. Hypervitaminosis will arise in terms of toxicity either in the acute form or chronic form, and if the female who are conceiving and who are pregnant in the first trimester, if they are taking vitamin A in excessive amount or greater amount, so it may lead to cause teratogenic effect in the fetus development. What is teratogenicity? Do you know? That is the development of deformed babies. Some of the babies having no limb, their ear is defective, their nose is defectively formed, the limbs are not arising. You have observed several children having one finger or one extra finger, some of having cutted hands, and some of having no palm area. So this may be the reason of certain drugs which are taking in initial trimester unnecessarily. So at that time the embryonic development is started, so whatever the genes are synthesizing and whatever the genes are given treatment, they ultimately adopt that toxic effect, and it will arise in terms of deformed babies. So if we talk about acute hypervitaminosis, that is the high intake or dose of vitamin, so what it will produce and what type of symptoms will arise if we have taken vitamin A at once in the high amount. So the acute symptom, there are two type of symptoms. Acute symptoms that will arise immediately, and those symptoms which will develop slowly and they will arise in the later stage and they will be prolonged.